Hello everyone, this recording will provide a brief overview for you on understanding the Provider Status Initiative as we talked about during class. And so the first thing that I wanted to do is just to review the bill and how it's been introduced and where it's been introduced. So again, Provider Status is a federal initiative that has been introduced into the federal government. We have two versions of the bill. The first within the House of Representatives, and so that is H.R. 92. It was introduced by 4 representatives in January 2015, one of which is from North Carolina, G.K. Butterfield. This is a reminder and refresher for students, and you all probably weren't in pharmacy school for the first iteration, is this was reintroduced legislation from the 113th congressional body, and that was H.R. 4190. Currently, we have 291 co-sponsors, which is huge. That is over half of the House of Representatives, and something that they have never seen before. Those include Richard Hudson and Mark Meadows. Those are the representatives who cover both the Hendersonville and Wingate campuses. Of note for you, 10 of our 13 legislators within the House of Representatives who represent North Carolina are currently sponsors or co-sponsors of the bill. Of note, I live in Indian Trail, and Robert Piffinger covers Indian Trail and sort of a little bit north of the campus. He is currently not a co-sponsor, and at the end I will provide a list for you of those who are currently sponsors and not sponsors. It has been referred to Committee on Health of the House within the Energy and Commerce Committee. It has not been scheduled for committee vote yet or for committee hearings. The main reason is that we need to get a score on this bill first, and I'll talk about that in a few seconds. However, Mr. Upton is the chair of the Energy and Commerce Committee, and he has said that he cannot ignore this bill. Pharmacists and pharmacy students have been so strong, really pharmacy students, so thank you all for those who have advocated on behalf of this bill, that these are just unheard of numbers for over half of a legislative body to be just a co-sponsor, let alone in support of a bill. So thank you all for those of you who have advocated on behalf of this bill. Next, we'll talk briefly about the Senate version of this bill. And so it's the same exact bill, the Pharmacy and Medically Underserved Areas Enhancement Act. This covers provider status, though, that you hear tossed around a lot. This is Senate Bill 314 within the Senate House. Currently was introduced with 4 initial co-sponsors, one of which is Sherrod Brown from my home state of Ohio. Currently, we have 49 co-sponsors in the Senate, and mind you, we only have 100 senators, and so we're still at almost 50%, which is just amazing for a bill to have that many co-sponsors alone, let alone people who are in support of the bill. This was read twice and again referred to a committee. Hasn't had any committee action in the Senate either, because the big issue with this bill has been cost. So pharmacy is sort of the last of the table, is being recognized as a provider. Our colleagues in nursing are much more politically active than we are. Many or a much larger proportion of their practitioner body are members of their pharmacy version or their nursing version of pharmacy associations, and so they are much more in tune to the importance of advocacy, and so that's why we've had nurse practitioners for so long. We also have physician assistants, and so pharmacy has been the last to come to the table, and we are really being charged with our astronomical healthcare budget to be savers instead of costers, and so that has been a major holdup with this bill. I think we've done a great job as a profession of pharmacy really trying to advocate for what we do and how we can take better care of patients, what our role on the healthcare team is. But the big issue is, despite whatever we can offer, we have to find a way to save the healthcare system money in order to get provider status. So a brief summary of the bill for you. What this does is it amends Section 1861 of the Social Security Act to recognize pharmacists as providers within Medicare Part B. So currently, we are not recognized as healthcare providers. Everybody follows suit for Medicare Part B, or all versions of Medicare. And remember that Medicare Part B is going to be what covers medical services. So when a patient goes to a clinic, an outpatient clinic, that is who is going to be billed. And so that's why we are trying to amend Medicare Part B to be recognized as providers. So currently, right now, if I were to submit a claim to Medicare under Part B, they do not recognize me as a healthcare provider. What else this does is it requires payment for pharmacist services at 85% of the fee schedule for what physicians currently bill for. The reason that we're going in at 85% instead of 100% is sort of a continuation of previous efforts from many years ago. And so it's a way to try and get your foot in the door. If you ask for a little bit less money, you're viewed as a less costly alternative. And so that's why we're going in at 85%, is it's a continuation of a previous initiative, and it's a way to try and get your foot in the door. You always come out with a bigger ask than you actually want, trying to, at the end of the day, whenever all the negotiations have been made, end up somewhere that you're actually hoping to be. And then the last part of this is coverage. So pharmacist services would be covered. Sort of essentially what it boils down to is if you're billing incident to in a physician office, if you're within a healthcare or health professional shortage area, a medically underserved area, or medically underserved population, and it's within the jurisdiction of your state practice act. And so in North Carolina, we have the Clinical Pharmacist Practitioner, or the CPP. And so if a pharmacist was a CPP, our Practice Act would already allow pharmacists that privilege. And so we do have that in our favor in North Carolina, that our State Practice Act does allow us to provide these services. Pennsylvania, on the other hand, their Practice Act is very limited. I believe they can only administer a few immunizations. They're really limited in their ability to enter collaborative practice. I don't believe that they actually have it, and so that would be a much bigger barrier if provider status were to pass in Pennsylvania. Some things that I want to talk about are sort of the politics of provider status, and understanding that if we get provider status and are recognized as Medicare Part B, the fight is not over. So this Link Care Pharmacists Provide Care campaign is through APHA and then a collection of other pharmacy organizations. It has a way for you to send a letter to your legislator, provides a lot more detail on this. So as I mentioned, pharmacy is really being charged to be a saver, and so part of the big holdup is as to why this bill hasn't been scheduled for committee hearings yet. We haven't seen a vote or anything, as we're waiting for a score from the Congressional Budget Office. There's some miscommunication between parties, and so we've been really delayed in getting this. We're hoping for a score of around $3 to $4 billion. I know that sounds like a lot, but when you're looking at the fact that this bill will be scored over 10 years and sort of a healthcare budget nationally, it's a fairly easy number for us to try and find money elsewhere for things that we would give up, or areas that we could say we could save that amount of money. It's going to be a much different scenario if it's a $10 billion bill. So as I mentioned, we're being charged to be savers, and so once we get that score, we're going to have to find a way that we can either save the federal government that amount of money, or we're going to have to give something up in our sort of provisional budget that covers that amount of money. And there's going to be a three-prong approach to actually being able to perform clinical services as a pharmacist and being able to get reimbursed for them. So the first is what provider status actually covers. That's being a recognized provider under the Social Security Act. After that, though, just because you're a provider doesn't mean that the insurance company actually has to reimburse you. So after that, it'll be a big battle to update insurance coding, payments, regulations to ensure that when we send a claim to Anthem or when we send a claim to Medicare Part B, that we're actually getting reimbursed, and we're getting reimbursed at that fair 85% rate of the schedule. And then the last part is going to be making sure your State Practice Act actually allows you to provide diabetes management and education to patients, that it allows you to provide any and all immunizations that are necessary for a patient, that allows you to manage a patient's anticoagulation therapy, etc. So as I alluded to earlier, this is not necessarily new. This initially gained momentum in the early 2000s before the Medicare Modernization Act. But then that came around and we realized that seniors needed coverage for their medications. And so with trying to get the MMA through in 2003, provider status sort of died off because the government had bigger fish to fry at that time. But that initial bill, part of the negotiations that had occurred before it died, was down to that 85% of fee schedule. A lot of people ask why medically underserved. All patients need our services and care. Why are we only doing underserved? And that's just a way to get our foot in the door. So we have a lot of medically underserved populations in areas within the United States. Generally, our physicians don't want to go there, and so our physician colleagues can't really challenge this bill too much whenever it's an area that they don't want to go to or a population they don't want to care for. Realistically, what's probably going to happen is if this passes, we'll have to concentrate on really taking care of those underserved patients first. But I don't think that if you had a patient who was like myself, who, had a stable income and a stable career, that if they came to your clinic, that you wouldn't be able to take care of them. And then I already covered why it's at 85% of the physician fee schedule. So I just wanted to highlight for you medically underserved areas and populations that just looks at sort of the concentration of primary care providers for the populations that need to be served. And as you can see, a good chunk of North Carolina is medically underserved. We've got a small pocket, most likely down in Union County, but most of Charlotte and Winston-Salem are not considered medically underserved areas. So the last thing I wanted to show for you is just a map of our 13 congressional districts here. As I mentioned, 10 of our 13 representatives are currently co-sponsors for the bill, so we've gained a lot of ground there. Unfortunately, neither of our senators are currently co-sponsors for the state of North Carolina. Richard Burr, I'm not entirely sure why he's not signed on as a co-sponsor for this bill. His office has not been the easiest for me to get into contact when I've tried. And this is really frustrating for me because, as I mentioned, that sort of initial provider status bill in the early 2000s, he was one of the introducing co-sponsors for that bill. So I'm not sure what's going on there. Senator Thom Tillis has told Wingate students and faculty that he is in support of provider status. He recognizes what pharmacists add to the team, but he does not want to step on as a co-sponsor. He will vote in support of the bill if it came to a floor vote, though. Part of the reason that he is not sort of putting his hat in the ring is, as I mentioned or had a slide titled, there's a lot of politics in politics. So he is currently a junior senator. He's still trying to make his name, make his way, form his relationships and alliances within Congress. And so he's sort of waiting in the wings for this one versus making this his hill to die on. So this last slide just shows you all of our representatives for the state of North Carolina and if they are currently signed on or not. So I'm hoping that some of our students had something to do with Richard Hudson and Mark Meadows signing on. They've been signed on for a long time. Robert Pittenger and then Patrick McHenry might also be representatives that are relevant. Robert Pittenger does cover part of the Charlotte area, Patrick McHenry up in the Asheville area. And so please go to congress.gov or go to house.gov or senate.gov, find the little Find My Representative button at the top right, figure out who your legislators are, and if they have not signed on, please contact them asking them to sign on. If they have already signed on, please send them a letter thanking them for their support. Hope this was helpful for you in sort of understanding provider status, and please feel free to contact me if you have any additional questions